They have tough time in bringing out. They'll sweat. It is hell for many patients. Early morning they get up, they sit. They after some time they are trained. They know how to bring out the sputum. What position, what postural drainage techniques they have to. Sometimes we help the chest physiotherapist and the doctors. We help the patient to initially to help them to drain out. What position is better? Suppose somebody has lower lobe lesion, so you have to ask the patient to bend further down, or patient lie down on the tummy and put the head end down and then cough out. So the legs up, so that the postural drainage takes place and the sputum comes out. So this is very difficult and it's very tough time for the patient and the family members. I have seen one of the patients, actually, who he was my primary school teacher, Mr. Sudarshan Rao. He passed away 3 years back. He used to have a lot of problem, and the whole house was stinking, and the family members also were fed up with him, and ultimately he died when he was 70 plus. So it's really difficult for the patients. The smell, too much smell, and it'll be disturbing. The whole life will be disturbed. So postural drainage is one of the very important thing, and chest physiotherapy. When you have to do, you make your palm like a cup, and do the chest physiotherapy all over here and the back. You have to tap like that vigorously, so that the adhesions will get released, and it will facilitate the drainage of the sputum out. So these are the various things, and after some time, patient will themselves know what position they can bring out sputum. Once they bring out sputum, they feel little comfortable because they can breathe little easily. So treatment part is over. Antibiotics is very important. Bronchodilators, steroids, and prevention is very, very important. Prevention. You have to give the pneumococcal vaccination and flu vaccination. Flu vaccination every year we have to give. Every year we have to give. And pneumococcal vaccination every 5 years we have to give. Especially anybody after 50 years. That is the indication now. Anybody, even if patient is very healthy, normal healthy person, you have to give every year flu vaccination and every 5 years pneumococcal vaccination. And especially so in these patients who are more prone for recurrent infections. So remember this. Anybody in your family is an elderly person above 60 or 65, please take them to hospital and give them a shot of adult. This is called adult vaccination program. There's a separate subject, actually, adult vaccination. So that is the prevention. And of course, we have to treat the underlying cause. Tuberculosis, you have to treat. If the malignancy, you have to treat. And whatever the underlying cause, you have to treat. Then I think we'll stop here, the bronchiectasis, and slowly go to other cousins of bronchiectasis, that suppurative lung disease. I was telling you the three types of suppurative lung disease. One is bronchiectasis, second is lung abscess, and third is empyema. Empyema, Arbas. Empyema is nothing but collection of pus in the pleural cavity. This is pleural cavity. If only fluid is collected, it's called pleural effusion. If pus is collected, you call it as empyema. Empyema, because there is a pus, it comes under suppurative lung diseases. Same thing if there is a lung abscess. There is a big cavity. Sometimes lung abscess can be diagnosed on auscultation. There is a typical finding. We'll talk about clinical examination when we talk in practical. Lung abscess, usually it is in the upper lobes. And there are typical findings. You can auscultate and examine, and you can more or less diagnose based on your clinical examination. And X-ray, of course, is it. In X-ray, lot of things here. One rib is coming, one fibrous, one bronchial markings. Everything is there. It is sometimes very difficult to identify whether what you are seeing like a round opacity is a real abscess, lung abscess, or something. Sometimes a rib will come, a bronchi will come. Everything looks like a round abscess. But what is the criteria? When can you say on X-ray that this is a lung abscess? You should appreciate 3/4 of the thick wall, at least 3/4. Many times you can see a full round circle, but if you can see 3/4 of the thick wall, you can diagnose as a lung abscess. Lung abscess, sometimes you can see the pus, the the upper level of the fluid pus here. You can see. Can I have the picture here, please? Can I have the picture? I'll show you the picture of lung abscess and empyema also. I have shown the X-ray and the CT scans. Okay, first I'll show the lung abscess. Can you see that? There's a lung abscess in the left lung. Yeah, this is the lung abscess. This is a thick cavity that I was talking. You can see a well-rounded and surrounded by some inflammation, infection. This is the lung abscess, a very big lung abscess. Very big lung abscess. Lung abscess also can be a complication of bronchitis. Lung abscess can come alone in isolation, or it could be a complication of bronchiectasis. When the ectation is too big, it will turn out into an abscess. Next. Yeah. And this is your empyema. Empyema. You can see there's a thick pus here in the pleural cavity. Of course, there is a bilateral also. On the right side, it is a big cavity. The pleural sac, pleural cavity is filled with thick pus, and on the left side also. This is bilateral empyema, empyema thoracis. This empyema also can be as a complication of bronchiectasis sometimes. It will rupture bronchitis. Sometimes there is infection. Even simple pneumonia can cause empyema. So bronchiectasis is also one of the leading factors of triggering the empyema. So these are the three. Empyema, again, of course, treatment-wise, signs and symptoms-wise, even if it is empyema or even if it is a lung abscess, they come with same symptoms: fever, cough, breathlessness, sputum production. These are common symptoms for all three. That's why they group these three conditions as one suppurative lung disease. So signs and symptoms are same, and treatment also remains same. But if it is empyema, you have to drain the pus out because it is in the periphery. You can put a tube, intercostal tube drain